Okay, there you go. Okay. So, Clifton, can you tell us when we can start so we can start streaming?
Okay. Well, good afternoon, everyone here and also online. Thank you so much for joining us for our afternoon program hosted by the Family Life Ministries by Sister Raquel and Brother Jehoshaphat and all others involved. Thank you, and our guests. We thank you so much for being with us. We just want to thank you for just joining us on this very important topic concerning our health in all aspects. You know, with the gospel, health is truly important because the whole man has to be in good health for us to even be spiritually healthy sometimes, right? One affects the other. And Christ, in his ministry, he would have taken health very seriously, healing others and ensuring that everyone around him was as well as they could be. So we just want to say welcome, and we hope that you truly enjoy this afternoon's program and that you will take something away that maybe you could also share with others, and to know that, you know, God, with God, once we place everything in his hands, we can do on the practical side what we need to do to improve our health. Thank you very much.
Sometimes it's moments of brokenness which create the greatest transformations. Times where fear gives birth to faith, pain leads to healing, and chaos dissolves into peace. It's in these times we often see God more clearly. For in our deepest turmoil, He remains faithful. When our spirit is crushed, He remains strong. When our moment is too heavy, He carries the burden. As gold is refined by fire, we too are often refined by struggle. It's part of growing, changing, becoming. Lately, the journey has been difficult. Our breath has been labored. Our steps uneasy. But we stand in faith, knowing who is leading us through this desert. The God of peace, the God of hope, the God of restoration.
Good afternoon, everyone. At this moment, we'll just bow our heads or stand for us to have a word of prayer. Our most gracious Heavenly Father, we are so thankful to you for coming here once again to sit at your feet and to learn of your love and your mercy and your care towards us, your children. We know that you are a God who left heaven to come here so that we can have life and have it more abundance. You are the one who created us. You are the one who has sustained us. You are the one who let us know that you are the giver of life and we rely upon you. Now we're in this world of sin and we go through so many troublous times in our lives, but we know that you stand by us. It is your intention for us to have good health. It is for your intention for us to live a beautiful, peaceful life. And Lord, we surrender to you at this moment, and we pray that whatever information that is going to be given to us tonight, that it will help us to take care of our bodies and to help us to remember that our bodies are the temple of the Holy Ghost. We're thankful to you for the presenters tonight. And Father, I pray that you might help that as they present, that they would recognize that you are the only true God and you are the only wise God. And whatever knowledge you have given to them, help them to give it to us at this moment. Be with those who are in line, those who did not find it possible to be here. I pray, Lord, that you would also be blessed. And as we go through the rest of this evening, help us to remember that your presence is here with us. And we give you thanks in Jesus' name. Amen.
Hi, welcome to Ottawa Public Health's Neighborhood Wellness Hubs. My name is Kim, and today I'm going to take you on a tour of one of the many wellness hubs we have located across Ottawa, offering you a safe space to drop in and talk to one of our caring staff. Follow me to know what to expect and to meet some of our partners.
These wellness hubs were created with the support from many partners, which means you will have access to additional services. What's more, you don't need a health card or to make an appointment to come in and chat with us. We are here to give you easy access to important services. Did you know 1/4 of Ottawa residents who wanted mental health supports did not know where to find help? Of these residents, 40% identified as visible minority or racialized. To reduce the barriers to accessing mental health services, Ottawa Public Health has located these wellness hubs in neighborhoods where health inequities exist.
So when you come in, you will see an Ottawa Public Health booth set up with many mental health and substance use health resources. Here, you will be greeted by culturally diverse public health staff who can provide strategies, tips, and resources on wellness, support you with booking short-term counseling through Counseling Connect, and can assist with referring you through Access MHA and One Call, One Click. Now, let's go meet Marie-Claire, one of our partners from Community and Social Services. Hi, Marie-Claire. Can you talk to us about the services you're offering through these hubs?
Hi, Kim. Yes, of course. This is the Employment and Social Services table. We represent all kind of programs like Ontario Works, Ontario Disability Program, and EHSS. So depending on the needs of the person or the family, we go through those programs for funding or coverage. We help people in the community with financial assistance, with housing help, or any to secure housing, or any employment support. We have here some posters to help you with our services. So Ontario Works program, we have all kind of services. We have for basic needs, health benefits, employment, learning program, life stabilization, or emergency assistance. So that can help your team navigate a little bit more with our programs here. And just for me, for myself, I'm an outreach caseworker, so we are new in the community and with the hubs. We have different locations, and this is our new team and our new goals.
Thanks so much, Marie-Claire. These are some great services that you're offering to the community. This is our quiet and safe space for private conversations. Here, you can chat with one of our staff knowing that everything you say is 100% confidential. Everyone has a story, and we're here to listen.
For more information and to find out which hub is nearest to you, please visit ottawapublichealth.ca/neighborhood wellness hubs.
So thank you for coming. Thank you for our guests. Before we introduce them, I want to say when the pastors told us about Erika and Dr. Malemo, we had a small discussion and we quickly decided that it would be valuable for the church to know about the resources for community because we all know that as Jesus was our example, he was the one who showed us that we had to meet the needs of the people in the community before being even able to share the word. So this way, we wanted to have those people with us to share with our church, with our community, so that we know that there are resources out there. We know that we came from a pandemic where there was many challenges, either mental health, financial. So I think this is going to be really valuable for people here and for people online. So without further ado, I'm going to first introduce Dr. Luc Malemo. So Dr. Luc Malemo is a bilingual family doctor and surgeon from the Democratic Republic of the Congo, DRC, who moved to Canada in 2017. After completing his medical training in 2002 in Goma, he worked 15 years for Hill African Mission Hospital in Goma as a clinician, researcher, advocate, hospital director, dean of training and research programs, transforming the hospital into a surgical residency center in a partnership between the DRC College of Surgeons and the College of Surgeons from Eastern, Central, and Southern Africa since 2016. In 2019, he completed a master's degree in experimental global surgery at McGill University, where he had the opportunity to also work as program and research planning project officer for the Health and Social Services of the South of Montreal. He then joined the Ottawa Public Health in April 2021 as a project officer with the goal of engaging particularly with the African and Caribbean Black community of Ottawa. During the pandemic, his primary role was to engage with the African, Caribbean, and Black community of Ottawa to ensure their voices were heard and they had access to evidence-based public health information and services. As we continue to learn to live with the pandemic, his role is to continue collaborating with the African, Caribbean, and Black community leaders and associations under the mandate of equity, diversity, inclusion, indigeneity, and accessibility.
Yes, and now I will be presenting Miss Erika Kamikaze, his project officer. So Miss Erika Kamikaze is part of a new community engagement team at the Ottawa Public Health, focusing on building partnerships and relationships, particularly with the African, Black, and Caribbean communities as a project officer. So she holds a bachelor's degree from the University of Montreal. Yes, my husband and I are also from Montreal. We're happy to hear that. And where she learned to develop, adapt, implement, and deliver reproductive health-related interventions. She has over 10 years of experience working with nonprofit and community organizations. However, within the past 2 years, her focus has been on planning for immunization and other targeted preventive measures against COVID-19, of which also included a better understanding of challenges, barriers, and needs of the various communities. But once again, especially within the African, Caribbean, Black, and Francophone communities, providing them with better access to evidence-based public health information and services has become her ultimate goal. So without further ado, please help us welcome Dr. Luc Malemo and Miss Erica Kamikaze.
Hello, bonjour tout le monde. Bonjour, parfait, il y a des francophones aussi. Donc, my name is Erica Kamikaze, and I'm here today with Dr. Luc Malemo, as so well introduced. We wanted first to just take the time to really thank you, both Raquel and Josephat, for making this day happen, for coordinating it, for having meetings with us. We are truly welcomed, and we're really happy to be able to share some of the information regarding public health, of course, but other services and resources, as we saw just earlier on the video. So before we start, we usually start with a land acknowledgement, so I still want to be able to do that today. So Ottawa Public Health honors the Algonquin Anishinaabe people on whose unceded traditional territory the city of Ottawa is located. We extend this respect to all First Nations, Inuit and Métis peoples, their ancestors, their elders, and their valuable past and present contribution to this land. We recognize the impact and legacy of settler colonialism, there you go, my French is coming out, and ongoing systemic racism on the Inuit and Métis peoples. And we pay tribute to the survivors of residential schools, their families and communities, and to the children who never came home. We are committed to implementing our reconciliation and anti-racism policies and action plan to address health inequities and improve outcomes of deserving groups. Welcome. So we wanted to just start with presenting of what does Ottawa Public Health do. So Ottawa Public Health really provides health programs, that's one thing, and then also services to individuals but also communities, while advocating for public health policies that make city and its residents healthier and sometimes safer as well. So health equities is quite important because it really highlights the need for all individuals, regardless of socioeconomic status, to be able to have access or equal access, sometimes equitable access to health. And we really want to make sure that our programs or services are known to community members and access as much as possible. Highlighting health equity is something that we've really had to push forward at Ottawa Public Health, and we can see it now by some of the new ways towards and working towards having a better strategic plan, but also kind of equitable opportunities for health for all. So with the monitoring and reporting of a relationship between either the social factors, hi, welcome, and the social factors like income and how it affects health, but also kind of developing partnership to key community members, to faith leaders, to mothers group, all the way to working with community health centers as well. So we want to continue developing this partnership, but also maintaining them. but also working with people facing health inequities and always making sure to modify all services as well to the needs of the specific population, whether it be by adapting a language, by having these services closer to where residents are located. And we also want to continue and participate in developing and addressing social determinants of health. So just to making sure that the information that we have here today has been updated as of this week, we always encourage everybody to access our website where you can find the wonderful video that we saw earlier, but as well as a lot of information about our teams, our services, our approach, and a lot of different information regarding your health as well. So there's a lot of tablets around questions and answers and most relevant questions that are being asked often as well. So I do invite everybody to take a moment and visit the Ottawa Public Health website. Luc and I are part, I would say my friend and colleague Luc, are part of a wonderful team. We would love to call it a family, but it's called the Community Engagement Team. And it sits within a very new, as of I think a few months ago, a branch called Health, Equity, Diversity and Inclusion branch. That is part of Ottawa Public Health now. We'll be sitting the community engagement as well as anti-racism, Indigenous health, and other as well kind of supports for disability access, and it's still ongoing as we are changing a lot in Ottawa Public Health, but we're really happy and kind of proud to see the results of the works of many years, but also of our team. So part of our team, of course, is not only representing the community we serve, it's also speaking the languages. So some of these languages are the ones spoken by our team. We were at 12, but now at 11. Unfortunately, one of our colleagues that spoke simplified Chinese Mandarin moved to a new position, but all these languages are some of the ones spoken by our team, but I'm sure that throughout Ottawa Public Health there's many others. And one of the importance of it as well is to be able to, I see questions, but we'll get to it if you don't mind at the end, just because of sake of time, we want to do it as fast as possible, but I will remember that. So we want to make sure that the information that we have can be shared in different languages as well, and preferred languages of individuals. I'm going to fast forward a little bit because I do want Luc to really talk about the services, but we're part of a team that started in 2020, as well working in neighborhoods and working with racialized population who experience disproportionate negative effects, prevalence, but as well as rates of COVID-19. So our team is diverse, it's reflective of the people that we work with and we serve. I would say that we work with. And it's a team that has really a diverse sets of skills. Some were social workers, some are doctors, some were working with the community for many years. So all of us coming in and working as we can to build trust, which is a really important one, maintain relationship. I think one of the essential work that we had to do was really regaining the trust of, or gaining the trust of residents of Ottawa. Not everybody knew of Ottawa, but not everybody had a positive past with Ottawa Public Health. So we really wanted to be in the community, work with community members that already, and leaders that already had that trust, but also kind of continue being present and being consistent. Of course, the importance of health promotion, decrease these inequities as well, and decrease the barriers. And as always, that advocacy piece of listening to our communities, but also coming back and advocating for changes to be made. So I'm gonna go a bit faster, but the key focuses of our team is both from a neighborhood approach, but also an ethnocultural approach. So working with people who live in marginalized conditions created by, of course, the system of inequities, but also, so that would be underserved neighborhoods, folks that are as well, not everybody has access to folks that are vulnerable, in vulnerable conditions, people who experience poverty, people who don't have homes or are underhoused, living in shelters, as well as advocating for folks that don't necessarily, especially during the pandemic, have access to sick leave or to babysitters. So it was really making sure that the, let's say, vaccination or the information session were at a time that would work best, or were really putting those issues and those barriers up the front of our planning and strategies. And the other approach is where kind of my colleague and I come in, working with not only newcomers, Francophone, folks that speak Arabic and that would speak Somali as well, but of course all the other languages that we mentioned earlier are part of that. So I think I touched on a lot of the challenges and barriers that we faced and that communities who are underserved are facing. But for us and our team, working with in neighborhoods, working with partners, it was a lot of barriers related to like the food and shelter. People had really needs that were prior to, let's say, going to get vaccinated. The needs were shelter, it was food. So if we could connect individuals to resources to support their essential needs, we could then kind of continue having that conversation about how to do that in a safe way, how to wear a mask when you go to the food bank, and other things in related to vaccination as well. So, of course, the trust building, having access to language. Weather was not always on our side, especially in the winter, but continuing to be present and part of the community was also something that we definitely want to continue doing. So I will try to jump ahead. And some of the guiding principle of our work is always relationship building, trust building, making sure that we are making plans that are community informed. So making sure that the voices of the community is put at the forefront of decisions that are made, but not also changes that need to be made as well. So I spoke about our work as well, but a lot of it is community. We have a community of practice with different, that was co-created with different community health centers, food banks, and stakeholders and leaders in the community. And there's also, of course, the mobile clinics that changed into the health and wellness hubs. A lot of distribution of resources, presentation like we have here today to just really put forward the services that we have. I mentioned some of our external partners, Youth Services Agency, Aging in Place. Our elders were very much so vulnerable to the pandemic, and we wanted to make sure that in what we've done or what we did in the past was really meeting them. So the door-to-door vaccination, the really going at each door, giving them information, giving them masks, and sometimes we would think, okay, we'll bring pamphlets, but can they read the pamphlets? Is it big enough for them to read, but also is it in the preferred language for them to read? And can everybody also read? So a lot of work was done around folks in aging in places, but also in shelters, and working with settlement agencies and places of worship, and working with community leaders that were already trusted and listened, and as they informed us of how we should go about the work that we do. The very last slide before Luc is able to talk about some of the programs and services is really highlighting the neighborhood health and wellness hubs. So these were created to address some of the barriers to access social or health services. And they started with the access of COVID-19 vaccination, with the mass clinics, because that was also limiting access to certain communities and populations. So we really worked on focusing on those neighborhoods that were underserved and that experienced disproportionate health inequities. So these hubs provide a lot of information, whether it be, oops, I'm skipping a slide, sorry, whether it be by So drop-ins for parent drop-ins as well are part of it. You'll have mental health and wellness. You'll have dental health, so they can help parents register their children to Healthy Smiles, or help seniors register as well to the program for seniors. There's, of course, vaccination. Right now, a key point is the routine vaccination, as folks have taken a bit of, but Luc will talk about it, so let me not give a lot of it away. But some of these health and wellness resource hubs, we do invite you. They're all across the city. Bayshore, Saint Laurent. There's one in Michel Heights right now. And Michel Heights, which is really quite special, is that we have Dr. Shrev from the Black Physician of Ontario that's there twice a week, offering wellness checks to individuals. And she'll be there until June 23rd, if not I'm mistaken. So no appointment needed, no OHIP needed. It's really a space to not only gain information, but if you want to speak to a family physician, I'm not able to prescribe, but can always do wellness checks and help you navigate the health system. So before I thank you all so much, I'll pass it on to my colleague, and we'll be able to connect during the Q&A part.
So thank you, Erica. So as Erica was saying, in these centers, the aim of these centers is to provide services near to the population, and here she was covering the vaccination, mental services, well-being. Now the next thing is immunization. I think we all know that it is very important to get immunized because it is a preventive measure. We can avoid so many illnesses if we get the immunization. This includes children, so adults and seniors can access the immunization which they may have missed. Or, for example, during the winter, the seasonal vaccine can be accessed. And also, it is available on our hubs and some pharmacies. This is just an example of a vaccination which was a mobile clinic, because the goal is to get closer to the people. So, as we said, these routine vaccination for children are very accessible at those hubs, and it respects the Ontario publicly funded vaccination schedule. So, and it starts from 2 months to 17 children, but as we said, some adult and senior may need some vaccination, including pregnant women. You know, they need some vaccine specific to the pregnancies. And maybe of note here, we know that especially newcomers who come from outside Canada may have their vaccination not complete. So in the hubs, you can actually find a practitioner, a nurse, who can see the vaccine you got outside Canada. She can help update them and put them in the yellow card, because we know the vaccination are required to access some places like daycare, like school, and even for traveling. So it is very important to make sure we have the vaccination up to date, and we can access these easily. Sometimes we don't even need an appointment. We just show up, and the nurses will help you to give you vaccine, to complete the one you're missing, and to make sure you are up to date with the documentation. Parenting in Ottawa. This is another big service Ottawa Public is giving. We know that our mothers are experts in looking after children, but sometimes there are things we may miss if we don't get the proper information. And I like giving the example of a mother who told me that she had got many children, but she has a 17-year-old boy who was born with a congenital anomaly. And unfortunately, one of the testicles was stayed in the abdomen. And even if the mother was with birth the boy every time, but I think the mother didn't pay attention to, because she's not an expert. So this is why this service will give the mother all the advice to see what can we look after, how to they can give peer parenting support programs. They will give parenting drop-in, home visits, and lot of prenatal courses. The goal being to make sure our baby grow to their optimal capacity. However, this is not an emergency health services. This doesn't mean that if your child is very sick, you can go here. No, you'll have to go to maybe to see your family doctor or to a walk-in or to go to CHIO emergency department. So OPH is also able to offer a lot of free dental services, especially when outcome is an issue. And this can be preventive care for children, even for adults. So you can go to these hubs and you can find a professional who only can examine your teeth, to do a visual exam, but also they can help you apply for the different services which are available to you, if that is an issue. I will go quickly. Yes. So, yes, we have printed these resources so that maybe we can share them to those who may need them, to know where to go and the schedule. Good question. So we know APH on the hubs, so there are so many mental health resources which are available, both online, you can call these different numbers, or in the hubs. For example, Counseling Connect can provide a quick access to a free phone or video counseling sessions, and they have many languages, both English, French, and in Arabic. We have Bounce Back. But if your child is experiencing thoughts of suicide or harming yourself, this becomes an emergency. You need to call this number. But for other usual, if you think you need some counseling, you are depressed, you can go to these different hubs, and we can give you the addresses. We can find where mental health services are available. They can give you some counseling to make sure your mental health is optimal. And these are other different resources. Most of them have been translated in many languages, like in Somali, in Mandarin, in Arabic, and so forth. We know harm reduction services. We know some people, they can take their choices to use drugs. The OPH goal is to make sure they don't get complications because of their decision. So they avail different services like distributing clean syringes, to give them counseling, the goal being to make sure to minimize the complication for the decision they have taken to use drugs. So we also have sexual health clinics, and here the most important is you can access family planning advice by speaking to a professional so that you can take control of your fertility. There are so many other services, as we said, healthy babies. We have the better strength and better balances. This is very important because we do know that even if we are becoming senior people, if we keep exercising, our muscle, including the heart muscle, will make us very healthy and we can actually live longer. So we make sure we support aging in Ottawa. We encourage healthy eating and nutrition, and we have injury prevention and safety. And again, when we speak about injury prevention, exercising takes a big role to make sure our muscles and our bones stay stronger. So, even if access to family doctors is not managed by OPH, because it is managed by the professional sector and hospitals, however, as you know, somebody who doesn't have a family doctor can go to this site, Ontario CA website, register into the Care Connect, and wait in the line. But it seems that if you have been waiting so long, there are our ways to get a family doctor. One of them is to speak to you, maybe a friend or a family member, to ask him, is there a family doctor is not accepting new people? Or I've seen some newcomers say they can even go and ask, walk in the city to say, doctor, are you accepting people? And one woman told us that this is the best way through which she got a family doctor. I remember recently I got a call from a newcomer from Cameroon, and I heard I heard from a friend that there was a family doctor in the city who is accepting family doctor. I just took the phone number, I sent in a WhatsApp group, and this family member was able to get family doctor. So we have to use all the ways, the official ways, which is going to this website, but also being very curious, asking friends and family members. So, thank you for your attention. We'll accept a few notes or comments from the House. Thank you. There was a video how to register, but I think for the sake of time, we didn't play it. Yeah. There was a question, I think, before.
Thank you, Dr. Malimo.
What role does the public health has for seniors who, when they cannot live in their homes, are not forced to live outside of their community?
It's a very important question. So let me think about that answer. It saddens me, first of all, that many of our seniors are in a place where they can no longer stay in the home of their choosing, either because whether it's financial, whether it's being able to be autonomous. And one thing, there's a piece of advocacy that social health services has done in the past, of making sure that they work with, depending on the agency or where the person lives, working with the tenants, working with the agency, seeing how they can make a plan for the person to continue, kind of that advocacy piece of continue being where they are. There's also, unfortunately, a situation where the person was not able to continue living independently in their homes. So we try to connect them to multiple services. One segue to my answer is Ottawa Public Health is not, unfortunately, responsible or able to offer services specific to housing. Let me say that. But we do have social services that are able to support individual, because that's the city sometimes. They're able to kind of wrap around services to support the individual going through a certain situation, housing, or food insecurity, and then connect them to, let's say, a social worker and a housing caseworker and another partner, and then adding the families as well, right? If it's possible. Not everybody has access to a wraparound service as such, but we try to make as many kind of safe way and connections to support the person within that time. It'd be hard for me to give a number. We always refer people to call 311, call your housing caseworker, social services, or the closest community health centers, because they have community outreach worker, community developers, social workers, but it's easier if it's closer to the person, because once again, seniors, we want to go meet them where they are. We want to be able to reach them. It's hard to tell them, oh yeah, go on this website, and they'll be able to. That's not the case. Not everybody has access to the internet. Not everybody is as tech-savvy. So it's a question that would be very specific to the person. And I think if you want to reach out to us, and we can try to see who are the people, and understanding that where they live is something we need to kind of know, and what they have access to, so we can connect them best. Long question, and I really hope I gave a few pinpoints of how we would go about it. Do you have? No? Okay.
So, in other words, there are so many different levels of government that sometimes older people got stuck in the middle and never moved from there. Another thing that bothers me about the help that is given, because if you want equity among everyone, there are some people who can afford to continue the way they were living, but others cannot. Are they made an Are you making an effort to bring that person to keep in their level of, that they have been living? Because when I look at these nursing homes, that all these big buildings that they're going up, hundreds of them, how many people can afford to live in them? Huh? They're not catering for the seniors. So maybe public health need to lobby the government to let them know, look, we want houses for lower income people. Because all these people are taking up all the space in Ottawa, and there's no space for the people who are of a lower income. So how do we get this equity? I mean, I don't know. I'm just feeling that, that's something that bothers me, because maybe I'm not there yet, but I listen to the radio and I find there are so many people complaining. We can't this, we can't that, we can't access this, and if we do access it, we have to go around the globe to get it, and by the time they get it, they don't need it anymore. So I know it's hard for you guys, but still, that's what people are feeling out there.
I really want to say that how important it is for individuals to give us that feedback, right? Because with that information or with that knowledge, I can be like, okay, this is a topic, this is a barriers individuals are facing, this is the reality of our seniors. How do we make sure that not only they have a specific plan, a way to go about these things, but how do we make sure that we're ready to accueillir, to
acquire,
to more than support, to take that on. Once again, Ottawa Public Health is very health prevention, health promotion, so it's not part of their mandate, but our role is very much so listening to the issues and making sure that, and finding who is supposed to answer to that, but also that advocacy piece, that making sure that people are aware of Ottawa Community Housing has specific buildings for folks from our seniors, right? Or co-ops. These places are in, or the rent substitute, yes, that's also available to health individuals that can't pay the full rent. They have access to that for at least 5 years, if I'm not mistaken. So all of these, once again, it's going around the globe, as you said, but there's options. It's just that connection piece, and that's where we're working really hard on. Yeah.
No, I was just going to ask you a question related to the previous. I noticed that I'm not sure whether it's the city or if it's public health, the aging in place program, which I find very encouraging because, for example, you would have someone come to provide the care where the people live. The idea is to maintain a lifestyle that will keep them where they live instead of going to a nursing home. Are you guys in connection with aging in place?
It's a multiple, sorry. So we are part of a partner working with Aging in Place. So our role in Aging, actually our colleague Maombi is very much so connected to seniors building and the Aging in Place program. So our role is to bring that health promotion and prevention piece, so pickup of medication. In the past, they had the Better Strength, Better Balance for seniors so that they can stay mobile and active. There's a lot of also discussion, and during COVID, we would do presentations. So we're at one of the pieces working with the Aging in Place. But some Aging in Place spaces do have nurses coming in and helping folks with food care, thank you. So there's, once again, there's the nurses piece, there's the engagement and prevention and health promotion piece, and there's also Ottawa Housing that's coming in with a piece as well. So there's multiple kind of individuals, yes, coming together. It was paused a little bit during the pandemic, once again, because for seniors, from what we understood, prefer having something in person there where they live, because there's always a community kind of center or community gathering space in the buildings. They would prefer to have it in person. with COVID, it was a bit difficult, but we've kind of started in distancing and wearing masks, but they wanted something more convenient, and it's also a piece of it was isolation. Folks felt alone, they were scared as well, the fear of meeting other people, being vulnerable in the sense of the pandemic. So we wanted to make sure that they had gathering spaces as well, and thinking about isolation, that health and wellness piece as well. I'll stop talking, but it's a lot of partners working together.
So I have two quick questions. So one piggybacks off of Dawn, Mrs. Dawn here, who was asking about seniors kind of staying in their homes. Is there a link or a website kind of that is a hub for maybe that kind of information that you folks are aware of?
I think the hubs would be a good place. Online, so if you, maybe we can have a lot of things open on my screen, maybe not. But if we, one part of a answer would be on our website. If folks are able to have access to internet, go online and all that, there's a phone number as well that we can call, and it's at the bottom of a document we're going to give you, but it's also on our website. So phone number and website, calling in and asking your question, and they'll be able, usually it's a nurse on the other end, able to answer, refer, add. There's always that piece of neighborhood health and wellness. If they're close to it, if they can walk to it, that's that answer as well. So some of it is FAQ, some of it is a little window with for seniors and seniors' health, and the importance of doing kind of chronic disease. We are starting to do at the health and wellness kind of diabetes screenings as well, working with the diabetes Ottawa community. There's a long name, but CDPO is their acronyms. So we're having more of those added to the Health and Wellness Hub once in a while. We also think of, okay, what else is important to our seniors? So sometimes it's in person, on the phone, online, but that information is available, and we'll share it.
Excellent. And the second question is simply, as interested community members, as citizens here in Ottawa, what can we do to provide advocacy and increased engagement and kind of help connect people to some of these resources that you guys are presenting? Are there any piece of advice you could offer?
Share. I think that Luc is very good at putting things and kind of bringing people together, but my piece would be sharing what you know, and then us, in return, we want to know as well, because that better informs what we do. So, and connect. So 3 pieces. Share what you know, the phone numbers, the website, the documents. Share with us what you know, and also connect us to maybe individual community partners that might not have access to information, that would want more information. That piece is also quite important, because that's how we build these bridges. And I'll let him answer the rest.
Maybe on one of the flyers, I think some hubs can offer specific service for assistance programs. What they will do is to sit with the client and see among those existing programs. So let her know the existing programs and help her or him apply for the program that she qualifies for. I think that can be a starting point. I think we have most of the flyers on the printouts. That maybe, yeah.
So we're already 5:15, so we're gonna accept 2 other questions, and then we're gonna conclude, so we can leave the space for our next men's group that's resuming. So one question.
Thank you. It's not really a question. I just like to share a little bit of my experience. I work as a visiting nurse for one of the agencies that work for public health. I work for St. Elizabeth. I know there are many other agencies, and part of our public are exactly the elders who wants to stay in their place, don't want to move to another place. And I don't know how accessible the service is, but I can tell that service is just amazing. We have clients who have like 4 visits a day, including PSWs, nurses, wound care, respiratory therapists, occupational therapists, So it's a wonderful job they do. As I told you, unfortunately, I don't know how many people have access to the service. But I can tell you the way they are able to reach the service is through the family doctor or the palliative doctor or the oncologist doctor. They are the ones who makes the referral. So that's the way we get them. And yes, it's possible. And many people nowadays, even palliative patients, they decide to stay home until the end of life. And they have all the support, they have all the need they need, the need they have from all the professionals. So it's something that really works, I can tell by experience, but I don't know yet how wide it is, how many people have access to this kind of service.
Yeah, I just like to, two questions I want to ask. And I'm learning a lot, you know. I'm really, really happy that I'm here because I'm getting there. Sooner or later, I'm going to call on you guys. So look out for me. I want to know, how does people really get a social worker? Because I feel if you don't have a social worker and you haven't got people who are navigating the system for you, you never get to know. And another question I ask, you said something about seniors with dental care. What is that care? Is it by professional doctors or is it by students?
Yes. So I think so. I think if you go to one of the hubs, you can see somebody who will help you apply for, maybe if you don't have a social worker, a person at a hub can help you play at least the initial role of applying for you and referring you to service that you need. But the care we are speaking about, there are so many care they are given by doctors. They are given by doctors, but you need to. So there are, if income is a limitation, at the hubs they can help you how to access them. But to answer, they're not by students, they are by dentists, even by doctors. But the hubs can help you see which programs you qualify for. And it can be preventive, it can be emergency care. So it's by doctor and dentist, not by, yeah. Did I answer your question? Exactly, yeah, okay. Thank you for your question. We'll take note of them. You're welcome.
Yes. Yes, before we hand over the mic, we really wanted to thank you once again, Josephat, Raquel. It's been a pleasure. For everybody that has been watching or will watch this later on, we're grateful for being here, but we're also kind of feeling welcomed and great questions. I think it's also important for us to reflect on them and to add them whether to a presentation or to a list of services program that we can have access to. So thank you very much.
Good evening, folks. I'm Pastor Daniel Kirk, as most of you know. I just want to say a quick thank you to Dr. Luke and also Erica for coming and sharing their expertise and knowledge with us. It's always a pleasure to have people from the community come in and help us understand how we can engage and how we can all be better together. I also want to thank these folks here, which we all know, for inviting them over. Like, this was a great idea, and honestly, I'm impressed, guys. I'm very impressed. Thank you. Thank you. Let's give them a round of applause, everybody up here. And I'd just like to wrap up with a quick word of prayer. If those who are able to, just bow your heads with me. Father in heaven, we want to thank you for this great presentation and for the chance to connect with some of our community collaborators and to find out who the other stakeholders are, and so that we can work together to make Ottawa better and to take care of the people that are around us. And we ask for your continued protection and watchful care over every family represented here. In Jesus' name, amen. All right, thank you so much, folks, and have a great afternoon. Oh, no, you know what? We have also Elder Sainville. All right, Elder?